We're in a national emergency. It's time we treat it like one.
On his first full day in office, President Joe Biden unveils his plan to tackle the coronavirus pandemic.
Our national strategy is comprehensive. It's based on science, not politics. It's based on truth, not denial. And it's detailed.
If things go wrong, not point fingers, but to correct them.
As the Biden administration charts a new course on COVID-19, Governor Eric Holcomb is cautiously optimistic.
We look across the state of Indiana and you see that positivity rate tick down, tick down, tick down.
We've since learned that there is no national stockpile.
Despite unexpected issues with vaccine distribution.
The system we have in place is to ensure that we don't have to do what other states have done, cancel vaccine appointments due to no doses available.
A major change on the federal level in the fight against the coronavirus pandemic comes as the state's vaccine supply lags. Good evening, everyone. I'm Brooke Martin.
And I'm Phil Sanchez. Thank you for joining us tonight. We have team coverage this evening, and we begin with News 8's Demi Johnson. And Demi, President Biden hopes to vaccinate 100 million people in his first 100 days.
Right, and it starts with setting up federal vaccination sites in every state. It's not totally clear how adding those sites will impact the state's supply and eligibility of those wanting to get vaccinated. Groups like the Indiana State Teachers Association are hopeful if all goes smoothly, they won't have to wait as long for their first dose. President Joe Biden put pen to paper with the goal of putting more shots in arms to stop the coronavirus.
While the vaccines provide so much hope, the rollout has been a dismal failure thus far.
But the president says help is on the way.
We directed FEMA to establish a COVID response liaison for each state, which means every state will have a point person at the federal level to maximize cooperation between the federal government and the states, and where it falls short, to be made known about it, be made known immediately.
Additionally, President Biden says FEMA is working to set up community vaccination centers across the country. The CDC is in the process of launching the federal pharmacy program to make vaccines available at places like CVS and Walgreens. Biden says part of the campaign would expand the pool of healthcare workers who are able to administer the vaccine, as well as ramping up production.
They are really talking about putting in place what we've been lacking, which is a federal plan to really get out there, sure that everybody who wants a vaccine can get a vaccine in a much more timely manner.
While we don't know if the federal and pharmacy sites will allow people who want to get vaccinated to bypass the state's plan, Vice President of the Indiana State Teachers Association, Jennifer Smith Margraf, says hopes are high.
We hear the most from teachers, but we're also hearing from other educators in the field that they are extremely concerned that they are not in line right now to get vaccinated.
President Biden says his plan will certainly speed up the process, but other efforts like mask wearing and international travel policies will be equally as important.
The brutal truth is, it's going to take months before we can get the majority of Americans vaccinated.
President Biden also warns the United States death toll will likely surpass 500,000 by next month. He says his goal is for 100 federal vaccination centers to be operational within the next month. In studio, Demi Johnson, Wish TV, wishtv.com, and follow us on Facebook.
Demi, thank you. Our team coverage continues tonight with Dan Klein, who's live outside the State House. And Dan, state leaders say they know some people are frustrated by the lack of available appointments to actually get the vaccine.
Yeah, and that's why they're not opening up the eligibility up to any additional age ranges, and they aren't even sure when they will be able to do so. But they say their number one goal is to never have to cancel an appointment for someone because there's no vaccine on hand. It's just really a matter of numbers. Indiana gets about 80,000 doses of vaccine a week, but there are 350,000 Hoosiers who are in their 70s, along with a similar number of people who are between 65 and 69 years old. Also, making matters more difficult, last week federal officials said they had kept some doses back in reserve, and so Indiana had started to plan to ramp up their delivery capacity. But then a few days later, federal officials said they were wrong. Their stockpile had already been given out to the state. So just about every vaccine appointment has been booked out for the next few weeks for Hoosiers.
The system we have in place is to ensure that we don't have to do what other states have done, cancel vaccine appointments due to no doses available. So while you may be frustrated at the availability of appointments, you can rest assured that our goal is to ensure that there will be a dose for you when you arrive.
Indiana still has about 286,000 doses of vaccine that have not been given out, but that's just above the 270,000 appointments which have already been scheduled. So you can see the numbers pretty tight there. And also one important tweak from today's press conference, the next age group, when it is open, the eligibility is opened up, has shrunk from those in the 60s to those from 65 to 69, again, to limit the eligible population. But again, no one knows exactly when that will happen. Reporting live outside the State House, Dan Klein, Wish TV, wishtv.com, and be sure to follow us on Facebook.
Dan, thank you very much. Lilly says its antibody drug can prevent COVID-19 in nursing homes. It's the first major study to show an antibody medication may prevent the virus. The study looked at more than 1,000 residents and staff in nursing homes, and according to Lilly, those who got the drug had up to a 57% lower risk of contracting COVID-19. In nursing home residents only, there was up to an 80% reduction in risk. U.S. regulators approved the drug last year for emergency use in patients who do not require hospitalization. All right, let's take a look now at the latest coronavirus numbers from across the state. Indiana health officials report 64 more people have died. Those deaths happened between December 22nd and January 20th. 9,218 Hoosier deaths are now linked to the pandemic. There are more than 3,700 new cases. More than 601,000 people in Indiana have tested positive. Our coverage of the state and federal response to the pandemic continues online. If you've missed either the governor's news conference today or President Biden's, we've posted both of them. Again, that's at wishtv.com.